I'm writing to express my support for the Lifeline Project work to improve protection from utility termination for medically vulnerable households in our state. Unaffordable utility bills are especially prevalent among low-income medically vulnerable households because these households lack the financial resources to make ends meet and often require utility service for ongoing treatment of chronic illness. As a medical professional, I see firsthand the way that termination of utility service can lead to disastrous consequences for families, such as an unexpected trip to the emergency room, the loss of a housing voucher, or eviction. Households with a permanently disabled individual or a person with a pre-existing serious medical condition such as asthma, chronic obstructive pulmonary disorder, or diabetes are among the most at risk because these conditions require electric medical devices or refrigerated medication. The Lifeline Project is a collaboration between the Rhode Island Center for Justice and the George Wiley Center, which aims to protect and expand the rights of medically vulnerable households facing gas and electric utility shutoff through the provision of legal assistance and community organizing. The Lifeline Project has identified a host of routinized, unfair, and illegal practices and procedures on the part of the public utility company National Grid and state regulatory agencies, the Division of Public Utilities and Public Utilities Commission, with respect to residential utility termination. These practices need to be fixed, and in the meantime, medically vulnerable households need protection from shutoff.
That's right. Yes. No shutoff.
I'm glad you agree. I'm specifically writing to support the Lifeline Project's current campaign to challenge these illegal practices and urge National Grid and the state regulatory agencies to meet the following demands. And now for the demands.
I'm from Aquidneck Island.
Louder.
I'm from Aquidneck Island. Newport Housing Hotline and Citizens to End Homelessness. From the George Wiley Center, a one-year moratorium on termination for all accounts that are coded as medical. 2,
That's right. What do people think?
It's fair.
Yes.
the engagement of an independent third-party monitor to review the Division of Public Utilities approval of petitions for permission to terminate for all accounts coded as medical. The monitor will be selected by a joint committee composed of volunteers, members of the George Wiley Center, the medical community, the Department of Health, and the Public Utilities Commission.
Right.
Yes.
Yep.
Right.
3, the Public Utilities Commission immediately begins requiring data submissions from National Grid as that are consistent with those requirements placed on the company in Massachusetts by National Grid, as per the George Wiley Center's formal request on March of 2015.
Yeah!
And the 4th resolution, the Public Utilities Commission immediately begin accepting and thoroughly reviewing petitions for emergency restoration and providing timely responses to each request.
Yes.
So now we're going to hear from who actually signed this letter, different medical practitioners from around the state.
As a medical professional in this state, I understand the dire need to protect these consumers from the dangerous impacts of utility shutoff. Sincerely,
Dr. Michael Fine, MD, former Rhode Island State Director of Health, Scituate, Rhode Island.
Pauline Sedgman, RN, Family Health Services, Coventry, Rhode Island.
Dr. Jordan White, MD, MPH, Assistant Director, Medical Student Education, Professor of Family Medicine.
Dr. Alice Zen Gross, Clinical Psychologist, retired, Kingston, Rhode Island.
Dr. Nick Siongas, MD, MPH, Brown University, Providence, Rhode Island.
H. Yvette Koch, Doctor of Acupuncture, President of the Rhode Island Society of Acupuncture, Providence, Rhode Island.
Dr. John Wang, MD, Internal Medicine Resident, Brown University, Providence, Rhode Island.
Nicole Anthony, RN, BSN, Community Support RN, Cranston, Rhode Island.
Dr. John McGonigal, MD, Clinical Assistant Professor of Family Medicine, Brown University.
Kate Josephson, LICSW, Providence, Rhode Island.
Dr. Daniel B. Reardon, MD, General and Vascular Surgeon, Kent Hospital, retired, East Greenwich, Rhode Island.
Janet L. Rivard Michaud, Occupational Therapist, Providence, Rhode Island.
Rachel Bishop, Program Coordinator, Health Leads, Providence Hasbro Hospital, Providence, Rhode Island.
Dr. Danny Ritchie, MD, MPH, Clinical Assistant Professor, Family Medicine, Lead, Transcultural Community Health Initiative, Brown University Center for Primary Care and Prevention, Providence, Rhode Island.
Christine Ward, Caregiver, Pawtucket, Rhode Island.
Dr. Paul George, MD, MPHE, Director, Primary Care Population Medicine, Professor of Family Medicine, Professor of Medical Science, Brown University.
Megan Y. Oline, Physical Therapist, Providence, Rhode Island.
Dr. Luba Dumenko, MD, Director, Preclinical Curriculum, Brown University.
Maureen Fisher, MSN, RN, CPHRM, Brigham and Women's Hospital, Boston.
Dr. Julie Taylor, MD, MSc, IB, CLC, Professor of Family Medicine, Brown Medical School, Dean for Clinical Sciences at American University of the Caribbean School of Medicine.
Lundy Brown, PhD, Professor of Medical Science, Brown University.
Dr. David Eagleman, MD, MPH, Clinical Professor of Family Medicine, Alpert School of Medicine, Brown, President GHETS, Editor-in-Chief, International Journal of Occupational and Environmental Health, Attleboro, Massachusetts.
Janine Castleman, Program Director, RI Medical Legal Partnership.
And Edward Feller, MD, Clinical Professor of Health Sciences, Policy and Practice, Clinical Professor of Medicine.
Wait, there's more. Gail Palumbo, phlebotomist, Roger Williams Medical Center, North Providence, Rhode Island. Dr. Michael Nissenholm, MD, Comprehensive Healthcare, North Providence, Rhode Island. Joyce Pellegrino, phlebotomist. Roseanne Kiev, Medical Assistant, Comprehensive Healthcare, North Providence. And myself, I'm a student working on my MPH at Brown, and I'm a board member with the East Bay Community Action Program.
All right.